Welcome to my video. For this assignment, I will be critiquing the middle range theory of modeling and role modeling. In this video, I will give an overview of the theory and present its key elements. I will give examples of how researchers have used this as their theoretical framework and critique this theory, ultimately rejecting it or accepting it for my own research practice. Let's get started.
Helen Erickson's modeling role modeling theory began in 1970 when, through reflection, she realized her purpose was to nurture growth in others. While Jacqueline Fawcett criticized some theories for having little relevance to clinical practice, nursing practice is actually the basis of this theory, because that is where Erickson became aware of the nurse's role as a healer. Fast forward to 1983, where Erickson published her first book about the concepts of modeling role modeling and the effects of the interventions, and now there was a book accessible to nurses to support use of this theory in practice. The theory uses concepts from other nursing theorists, specifically Maslow's hierarchy of needs, Erickson's theory of psychosocial stages, Piaget's theory of cognitive development, and the stress adaptation work of both Engel and Selye. While these theorists emphasize one concept, Helen's theory is holistic, showing that these concepts are linked and relationships exist. One central aspect of her theory is that it is client-centered, that is, the client's perception of the world is central to the nurse-client relationship. There are two major concepts Erickson described related to nursing: modeling and role modeling. Modeling is a process the nurse goes through to understand the client's perspective and worldview. It is important because this helps the nurse identify what is important to them. Role modeling occurs after and is the planning and implementing of unique client-based interventions. In order to role model, that is, apply client-specific interventions, Erickson explains the way in which people are alike and different. People are alike in that there is a connection between mind, body, emotion, and spirit in all of us. This is holism. We all have basic needs, we mature and develop over our lifetime, and we are all depending on our support system while also maintaining a degree of independence. However, we are different in our genetic makeup and characteristics. We perceive and adapt to stress in different ways, and we have different understandings of what promotes or hinders our self-care development. To apply this theory in practice, the nurse first has to understand the patient's worldview and their priority needs. From there, client-specific interventions are developed. The primary source of this data is the client, and other sources are family and the healthcare team. As with any nursing intervention, critical thinking is involved. To implement client-specific interventions, a trusting relationship with the client first has to be formed. Erickson's strategies for doing this include being present in the moment, creating a healing environment, and active listening. Ultimately, the role of the nurse is facilitator, nurturer, and unconditional acceptor. By implementing client-specific interventions to meet the basic needs, the individual is empowered to identify and use their self-care resources to contend with new stressors and adapt successfully. If the intervention does not meet the needs of the client, a needs deficit will exist until an alternative that fits with the client's worldview is found. So what does this theory look like in practice? Pamela Haycock applied this theory to her research of clients with advanced stage cancer. Understanding that often the needs of these clients are multifaceted and unique to each patient, the nurse can apply the modeling role modeling theory to anticipate, plan for, recognize, and intervene to optimize outcomes that address unique human responses to the disease. The client will have a concept of what has made them sick and what will have a positive effect on their health. That is to say, they will have self-care knowledge. A nurse could build on this knowledge and acknowledge what a patient believes to be important for health and healing. The nurse could help the patient recognize internal and external resources. They can offer referrals to external resources and services if a gap is identified. In this way, they are mobilizing resources for the client to take action and care for themselves in a way they perceive to be effective. Leigh Hagelin looked at the modeling role modeling theory in the treatment of factitious disorder, a psychological condition where a person fakes illness to attain the emotional benefits of being cared for by another. Nurse practices nurturance and unconditional acceptance through empathy with the patient, and they feel validated. In individuals with factitious disease, there is an imbalance in affiliated individualism and over-reliance on the healthcare provider. By applying the theory, the nurse can help the patients develop independence through finding possible resources outside of the healthcare system, restoring the balance. This theory is easy to understand with clearly developed concepts. However, holism could be further developed to include the way clients interact with and perceive their external environment. This theory uses theories from other disciplines and isn't very nursing specific. It could be applied by other healthcare team members. I also think this theory would be hard to apply if the nurse's client were a whole family or an entire community. How could I apply this theory where I am the nurse educator and the student is my client? A student is just another type of client with their own self-knowledge and worldview. They will have different ways they cope with stress, they will have different ways they learn, and they are adult learners with different perceptions of what is important. So what if we applied this theory to how an intervention, like a handheld device, could help a student adapt to the stress they experience in clinical? A nurse builds trust with their students in the ways suggested earlier, and they become the primary data source of what their stressors during the clinical rotation are. Then, if it fits, the nurse could use the handheld device as an external resource to help them adapt to the stressor. Maybe it's for looking up a drug. Maybe it's for texting the instructor to help with a dressing change. Maybe it's for setting a reminder to stay organized. A mobile device is a resource that can empower a student to do an action that will meet their needs. It might not be the best theory to apply, but it got me thinking outside the box. Thanks for watching!